to the Think Freely podcast. Well, welcome to our podcast. This is an awesome follow-up to our previous podcast, and that is because we were talking about fundamentals of living humans with sleep, drinking, and food. And in that podcast, I talked about Sleeptracker-AI. And lo and behold, we have the actual inventor who's not just an inventor, he's a mathematician, he's an inventor, but he's also the ones behind the very first camera phone that got commercialized, got shipped into, you published it out in Japan. I mean, you got it created in Japan, and then a bunch of other people started buying it up. Is that right, Philippe?
Well, the first shipments of the camera phone was in Japan with combination of J phone and Sharp, and then it got deployed in the U.S. 2 years later by Sprint. And then
Mhm.
it got deployed by AT&T, Verizon, and then all over the world. And today there's more than 7 billions of them, which is almost one for one for human, which is amazing. And it, to a lot of people, is the most precious possession they have because they can keep, even in less favored economies that we have, all their photographs, their videos,
Beautiful.
even when they don't even have a house.
It's amazing how there's been a leapfrog in these other countries where they just skip the power grids, the wires. They've gone right to wireless. They've got these phones. They've got the compute and so forth. And interestingly enough, something about me, this project I worked on recently with mobile technology was putting a patent from 2013 into a mobile platform where we were doing steganographic watermarking into images to do authenticity of those images. So those photos that you kind of started with your first selfie, like when at your child's birth, wasn't that the scenario? Um, uh,
Well, my childbirth was the culmination of about 8 months of work. Yes, I mean, there was a perfect uh,
Coincidence.
coincidence in time, but uh, it was wonderful because there was a birth of two things: the camera phone, and more importantly to me, my daughter Sophie. But that was 1997. Yes, that's correct.
Yeah, so you can measure the time of the birth of that creation with the birth of your daughter, which is pretty interesting parallel there. Um, but when it comes to the sleep tracker thing, the thing that blew me away was the ability to use this AI to look at heart rate, breath, and I know that you have the capabilities of sensing. I saw the one of your material presentations about differentiating with the AI between two people breathing, two people having heart rates, and I know the complexity is there. But with my mom's situation, we just have one person being tracked. It's under the mattress. It can sense exactly what's needed. It can tell when they're in REM. It can tell when they're in deep sleep. It can tell when they have these little micro awakenings. And I have a very old version, which you've provided a replacement. I haven't run it yet. And there's a new dashboard with all kinds of alerts and everything. So I'm really excited to dive into that. And I think that some of those things that you've already created probably are an answer to some of my hopes about what people can have with this sleep tracker as a component of caregiving for home care, but also enabling care centers which are plagued by people not in the know and patients that can't report. Almost like a veterinarian has to be really good to know exactly what's wrong with the animal because the that creature isn't going to tell them anything about symptoms or history. They're not a good historian. So,
Well, it's more than that. It's because if you want to scale the care of, for example, elderly people, there's a couple of challenges. One of the challenges is you give them a wearable and they're not going to wear it, or they're going to wear it and forget to wear it again. They're not going to charge it, etc. But on top of that, you can't put a nurse or a practitioner next to each person. I mean, you've done a great job with your mom, but you're special. And so what we've built is a system that's scalable, where we can actually empower the the caretakers, the
Mm.
clinicians,
Hmm.
to actually manage hundreds of people by providing a dashboard that has event alerts and triggers, and that allows them to know if something happens during the night. Because you know what happens with with people as they get older, we're in critical care. A lot of it happens during the night. Everything is much easier during the day, and it's much higher. I mean, harder to hire people who will work graveyard shifts, etc.
Hmm.
And so now you have a dashboard, and the
Yeah.
dashboard, you can see 100 patients. They get sorted by, their heart rate, and each heart rate, each patient has its own range and heart rate and respiration rate and heart rate variability. And our system also monitors the room environment, including temperature, humidity, and um, and air quality. And
Hmm.
what we found is some of the worst things that happens is people think, oh, there's something wrong, and then you figure out that air quality is terrible, or they sleep at a temperature they shouldn't sleep at, and
Yeah.
because the thermostat get changed or whatever it is. And so we
Yeah.
have all this integrated in one system, and this is a very, very pure application of AI, unlike a lot of things that are very theoretical. It's not about, helping you make spreadsheets or
Right.
write better or longer posting. It's about understanding the data and relating the data to people's health and well-being. And that happens completely remotely. It's completely invisible. It's contactless. The sensors are under the mattress. They're similar to the ones you have, but it's more advanced system. What
Yep.
you have was 5 years was a general Gen 2. We're right now at Gen 4, Gen 5. And so it's really exciting. And so we're starting to make inroads in that retirement community world and the world of nursing homes, et cetera. And that's, in my stage of my career, it's very important to me to do something that really helps people live better lives.
That's fascinating. You're kind of making me think about some other possible applications, which I know that you're not just a mathematician for mathematician's sake or an inventor you like to render and make a really focused rendering of an outcome. I think one of your presentations I caught, you were saying focus, persistence, and patience, and you've kicked out a phenomenal product. And we're not here, trying to be a big sales pitch. What I'm blown away by is there's lots of families out there that are starting to understand that their loved one is having some memory problems. And what if people started tracking sleep, especially maybe before that, even for other reasons, but let's just say, especially if someone, dad or mom has some problems in the home, and if your family was able to tune in and at least understand, like, are they sleeping at all? Are they getting their sleep? Are they not getting their sleep? Are they up all night? You could do an intervention sooner and get more, better addressing of the medical situation if you kind of can catch some of that stuff early. I'm
Yeah,
just think,
absolutely. But there's much more than that we do actually. And um, so we have over 200,000 people every night on the system,
Mhm.
and hundreds of millions of nights of sleep analyzed. And so part of our system, like for example, we have a partnership with a company called Ansible Health. They're specialized in COPD patients. So all
Mhm.
they do is COPD patients, and that's a big deal. And so
Yeah.
uh, what we do is, because we have that longitudinal history
Yeah.
of what happens with sleep with anyone, uh, with the tools we have, with the dashboard and the APIs we have and all that. So when there's a singularity, an event that happens, for example, um, a heart attack or stroke.
Hmm.
Like, we'll talk about Alzheimer's in a second.
Yeah.
Heart attack, because we do that too. Is a heart attack or stroke? That is something that happens, and it happened. Now we know it happened. Now we can look at retrospectively
Yeah.
at all the data in the last 6 months.
Hmm.
Not us, our AI, our analytics, our
Right.
machine learning. looks at that and tries to see for little micro changes whether there was a signpost, a warning sign somewhere, and look at that. Then when you have enough of these, use
Yeah.
the AI to look at this again, and
Yeah.
you basically have labeled data
Yep.
that allows you to actually create models.
Yep.
And those models may be, I mean, the whole thing about AI is making prediction. And so the AI, those models become our predictive models. And our ambition is
Hmm.
to help alleviate those challenges, whether it's a stroke, whether it's a heart attack. When the advent of Alzheimer's, it sometimes happens quickly, but in many cases, our experience it happens over time.
Yeah.
And the fact that we maintain a longitudinal history, that we have some people who have 5 years of data for which we have, and we have the tools to look at that. We we can apply exactly the same thing and see how the condition progressed
Yeah.
and understand that with enough people, maybe
Yeah.
10,000 people, and then create a model of this, what is essentially labeled data, and
Yeah.
then try to be predictive way before with anyone by looking at sleep patterns today, whether they're at risk and what the level of risk is. So this is use of what generally is known as AI. A lot of it is machine learning and modeling, et cetera. And and it's very practical. What we
Yeah.
do is very practical. And we're very excited because I don't think there's anything else or anyone else that does what we do. And what you describe is the first step. And of course, we do much more. It's this retrospective look at the data that allows us to make predictions
Sure.
that actually make sense. And even if someone has already the condition, we can predict, we can help alleviate the worsening
Yeah.
and help improve the outcome. I mean, so that's the passion that we have in our company. That's what we do.
So tell me, so um, when I was kind of frustrated with a care center not basically being able to take care of like the basic routine because the staffing challenges through COVID were hard, but just a lot of care centers don't have the ability to juggle like items a to-do list. I thought there might be a better way to have, and I'm putting a parallel here into this conversation that comes back to sensors, but I feel like these care centers, especially the dementia and the Alzheimer's care centers, I approached one of them and asked them if they would consider like doing a prototype because I could stand up a way for them to do some of this. And I didn't know that your system existed. I didn't know that your system is shipping to care centers, which is awesome. And I think I can tell you offline
Well, I mean,
who
our challenge, we're not shipping to a lot of care centers. We're actually developing that business. We have the technology. The biggest challenge is to get it out there
okay.
because it's a very fragmented business.
Yeah.
You need a whole sales force. You need. So what we're
Yeah.
doing, we're actually talking to multiple partners
I
to
gotcha.
help take this technology in the right place. The For me, the problem is not the technology. I've been working on this technology for 15 years with a fantastic team.
Yeah.
We've got the challenge is not the technology, is now taking it to,
Go to market.
scaling it in the market because
Yeah.
one by one doesn't work.
No, yeah.
It's one by a million that works. I mean,
Right.
so it's a sales marketing effort. You know, I'm not a sales and marketing person. I'm a technology person. So we're trying to push that as much as we can
Yeah.
and bring on board people who can really help with that because
Right.
you know we have something that's beautiful for that will help a lot of people. And we're working with Stanford Medicine, with UCSF. I mean, we're all vetted. It's really fantastic. But now the world of people who are aging in place or aging in centers or in
Hmm.
nursing homes can benefit from that. But getting it broadly distributed around the world.
Yeah.
Japan, for example, has a huge aging population or life, is an incredible business opportunity,
Yeah.
but it required a business company
Yeah.
or technology company to to partner with us or several of them
Right.
to actually broadly make it available.
No, I understand that. It's and I think for the most part, um uh we're about to be overridden by this like onslaught of the aging population maybe needing care at a level that I mean I'm thinking that the uptick is still coming, and even right now paying an exorbitant amount of money per month and them not able to provide, you know, really good insight. Like you don't really know that they're taking care of your loved one because the staff turnovers are so high. But if there was a technology that was monitoring them, you don't worry about it at the hospital in an ICU because they got all the monitors running. They're tracking everything. So like if you hand off between shifts and you do report, you know, they talk about some of the basics, but all the details are being recorded. And I feel like the only potential future of stability for care is going to involve, you know, your technologies and other robotic systems where humans can interact with it and be triggered or get alerts or interact with their care or checklists. And I feel aspirational that you've actually created this. It's pretty exciting that you have it.
Our dashboard is already in use, as I said, COPD patients,
Yeah.
um, apnea patients, and we're starting a pilot in Texas in a retirement home right now. And
Okay.
so and so having that dashboard for practitioner and also sleep clinics,
Okay.
uh, the sleep and brain clinic in Palo Alto, they're our neighbor here in Silicon Valley, but they already have more than 50 patients on that with using the dashboard and all that. And they're able to do, you know, what happens when people go to a sleep clinic, they get an assessment with a polysomnography machine in one night, and then that's it. And so uh, Dr. Anil Rama at the Sleep and Brain Clinic realized, he's also a lecturer at Stanford. He realized that it would be fantastic to provide a service to service to his patients to keep on monitoring and getting alerts when something goes wrong. They're not using their CPAP, or the CPAP is not set up functionally, or they now need a CPAP, et cetera. So what we have built collaboratively is a system that allows him to monitor up to 1,000 patients if he wants to. Right now, he's monitoring 50. And he's got this dashboard with all these event alerts and all that. You can see it on our website
Yeah.
at
I'll
sleeptracker.ai.
I'll put
And,
some of the visuals up if you want to refer to that. I'll put them up in post, and if you want to describe some of them.
anyway, the first screen of sleeptracker.ai describes what our solution does. And
Okay.
so basically from having one sleep monitor, we can handle, you know, 10,000 sleep monitors at a time. And basically you see all your patients, you'll be able to sort them, and you look at we monitor over 27 metrics
Okay.
that include like microarousals, HRV, um, uh, performance prediction for the day,
What's
all
HR?
sorts of
What's HRV?
heart rate variability.
Okay, a heart rate. Gotcha.
HRV is one of the best predictors of health.
Hmm.
So HRV, basically, people think that if it measures, HRV is a measure of the interval between heartbeats.
Gotcha.
And so it's the opposite of what people think. A lot of people think, oh, you know, that has to be constant. It's the opposite.
Hmm.
A healthy heart is a healthy heart where there's complete adaptability to whatever you're doing to the heart rate behind beats,
Okay.
if you want to say. So
Gotcha.
that's really an important. So these are all metrics that we
Yep.
provide that are really important. I know that HRV is one of the metrics that I look at the most, but our performance prediction index uh, includes HRV as well as micro, arousals. Micro arousals are wake ups that you'll never know about. They're micro wake ups that are technical wake ups from a sleep science perspective, but it's something that you wouldn't know that happened, but it actually happens. It's very important, and it's a very important characteristic of sleep quality, and that's very
Interesting.
important. So using all these metrics, you
Yeah.
can make a very deep assessment about about people's health. Um, you know, we are looking at being able to diagnose, and we think we can, um, the the development of the type 2 diabetes in people who don't have diabetes or the worsening of it, et cetera, because there are signposts of that condition developing. And all that is, it's a beautiful application of machine learning and what we call AI. All that has to do with retrospectively looking at events and having the ability to have that all that longitudinal
Yeah.
data and be able to use uh, state of the art, AI powered analytics. I mean,
Yeah.
I'm not a really good person at hyping AI, but this is a great, a great, a great application of AI. This,
Mhm.
uh, and and that's what we've been doing for 15 years. But we don't do LLMs and all that stuff. We actually use AI in a very pure way, and try to understand what events mean and trying to predict the next set of events. And of course, LLMs are useful and we understand them and all that to converse and do many other things.
Right.
But our approach to AI is a very different approach.
Mhm. Um, is there other
Same approach. It's the same approach, but it's something different.
Yeah, it's
So
a different application for sure. Um, so when it comes to other sensing things in the room, as a caregiver, I always wonder, like I wonder with the new room air quality, does that sense, let's just say if there's a patient that has a GI tract problem and they have a bowel incident, would that air quality sensor go off? What does that sense? And I'm
so
interested.
you could do that, but we don't do that today.
I got
Right
you.
now, we're looking at particulates in the same thing as purple air looks for when they give you a rating quality for the air.
Got you.
But we've never tried to see if someone basically has a bad digestive accident in their bed. We haven't tested that.
Yeah.
It does because it creates particulates and it's not breathing air. I'm not sure.
Yeah.
So I can answer that question. Uh,
That's all
we
right.
we would need to have we need to test that, but in order to do that, we need to set up a proper clinical trial and which is how we build what we build.
Right. Because there's so many aspects of skin breakdown and again, like timely care. If something happens, if they were able to remedy it right away, that's like one of those things that you know that your person's being cared for, 10 grand a month. And otherwise they don't know. And so those are things that I think, um, if you've got this sensor system, my thought is what other things can you sense, or tie into your main like portal or your main device that's not the sensor? Can that bring in other data from other sensors in the room? And are you exploring that or is that not discussed? It's kind of secret.
RIPI, if you look at, well, RIPI is for something for engineers and programmers, but our API allows you to integrate what we have together with as many sensors as you have, and
Okay.
we're bringing other sensors. But you have to. What we found with the aging in place or the nursing homes business, especially with in what I'm going to talk about Alzheimer's patients, what we found is that there's 20% of the events that deliver almost 90% of the stuff. For example, Alzheimer's patient, and many patients, one of the most important thing is to figure out whether they got out of bed and never get back in bed at 3 o'clock in the morning or 4 or whenever it is. Our system does that today.
Yeah.
So you can put in as many sensors and motion sensors and all that. Uh, you might not catch it, and you might catch it. So this is all right. We already solve a lot, probably close to 90% of the challenges, which is air quality, air temperature. Suddenly the room is at 80 degrees because someone just turned the thermostat, or it's at 60 degrees and they're freezing in there and they're shivering and
Right.
nobody. So, humidity in the air is the same thing. So
Yeah.
we already do a lot of that, and we correlate it to what's happening to heart rate, respiration rate, your sleep architecture, meaning REM sleep and all that stuff.
Hmm.
And so it's for myself every day, I look at this every day because sleep. What's interesting is a third of people's life. People don't understand that
Right.
it it's like a deep ocean. It's a great mystery. The Billie Eilish song, when we sleep, where do we go? And which is really true. And so you have that in front of you, and you're going to spend 8 hours, or on average, a third of your life sleeping. And you have an opportunity with a passive contactless system that doesn't need to be recharged, that doesn't need to be worn like we have, to
Yeah.
monitor that and analyze it and keep, years of records of that in high fidelity,
Yeah.
have that data trove right there, and be able to retrospectively look at, even if we haven't thought about certain things. For example, when the pandemic happens, we had probably close to 100,000 sleepers, and we saw so much massive changes, and they haven't we started seeing people sleeping differently when it started developing and as the virus progressed, and and then we saw all those changes, and we made a bunch of studies showing that. And then we saw how the world started, actually the world we monitor, 100,000 people, start sleeping in different patterns again. And
Mm.
could we have in some way predicted this? Of course not. We didn't know about, but now we have enough data to see whether, if there is another pandemic, are we seeing it developing because we see the same kind of patterns developing in large numbers of sleepers?
Yeah.
All this is about, it's just statistics, is
Yeah.
make predictions using AI. And so how can we actually do that and be successful? And so this is why we're passionate about what we do, because it touches everybody's life,
Yeah.
whether you're in a nursing home, you're in a retirement home, or you're working every day, or the next pandemic, or what's happening with the flu epidemic. Flu, sleep is a signpost
Yeah.
for your life in many ways. Your sleep tonight is going to be a function of what you ate, what you did, if you drank wine, how much caffeine you had, if you moved, if you broke a sweat, whatever. But your performance and how you're going to be able to be in terms physically, psychologically, etc., um, is a consequence of how you slept.
Right.
And we all know that. You
Yeah.
have a bad night, is something else. Sometimes you have a very short night and you feel great. And there all sorts of complexity in the system. But better sleep is good for everyone.
No, I love it. I love it. Um, and as far as you have another what's the parent company or the main company, not Sleeptracker-AI, but Full Power. What is it? Full Power?
Fullpower. Fullpower is a company, is our name company that basically builds the Sleeptracker AI platform.
Okay.
Sleeptracker AI is a platform. It's an end-to-end platform that goes from embedded software and the monitoring all the way to the cloud and all the AI tools that go with it. And
So
Fullpower is our company that builds all this technology.
So if there was care centers or people in the health industry that was interested in testing out your thing, is that available, or are you working with a very limited pilot program and you're not looking for more testing environments right now?
we're looking for as many as
Yeah.
saying we can produce as many as
Yeah.
necessary.
And it's the dashboards are all I saw that you have like a ton of compliance standards met like ad nauseum all over your site. I'm assuming that if it's like right now, if a care center wanted to like sign up, they could get access to the portal and test it out on some clients that agree to test, to work with it. Do,
Absolutely, absolutely. We're doing that already.
and do you have like I'm just fascinated by the whole full stack of business because I think in the full spectrum of like the legal agreements. So like are there special like sign-offs that or contracts that you recommend that they sign with their residents on having this data or how long the data is retained or the data privacy standards or how is that all dealt with, for HIPAA, for example?
We're HIPAA compliant and we comply with all the standards, actually, standards worldwide. Uh, so we deal with all of that, and that's how we do all our trials and how we work with Stanford Medical and all that. We we actually do that. In fact, the the challenges are in that perspective are greater in Europe, for example, or in Japan and places like that where they have more restrictive laws, which are great. And so
Yeah.
we comply with those, which makes us easier for us to comply in the U.S. And as I said before, Japan has uh, an incredible challenge with aging population, and people live much longer in Japan than they live here, and
Mm.
people are uh, age in place in many times. So it's been a great opportunity for us.
Is there ever any potential for, how like my background as an occupational therapist, I'm licensed therapist, I'm not practicing, but I'm aware of some of these situations where you have like these very advanced mobility systems, like Permobile, where it's a fully, I don't know if you're familiar with these big electric wheelchairs that have kind of wraparound supports for the body, and I'm just wondering how well those devices that you have already could be, just kind of even tacked on to the back of these setups or integrated in some way
We've
to,
done
yeah,
we've done that. We've worked. We actually have a prototype of a wheelchair that's integrated with this, because of course what we realized very quickly is that the bed is one thing, and but if you look at our sensing technology goes under a mattress, any mattress.
yeah,
The AI basically, whether you have a 2-inch mattress or you have one of those 2-foot mattresses with cores and all that, the AI calibrates itself automatically.
yeah,
And so what we've built is a system that we can embed in a wheelchair that continues that monitoring. And so we do all that. And we don't have an agreement with any of those companies, but we'd be delighted to.
yeah,
And we have the systems working. Again, we are like a research organization. We're a
sure,
development organization. So the opportunities for us is to partner with
yeah,
people who do sales and marketing, but we do have, fantastic partnership with a betting company called Tempur-Pedic,
yep,
and Tempur-Pedic is the world leader by probably tenfold uh, in betting, consumer betting, not
yeah,
not medical betting,
yeah.
and they're the world leader, and it's been great for us because they're excited about uh, partnering with us, building the smart bed, and they're really very successful people
And
with a
that's
great
currently an exclusive, as far as I understand. At the current, it's an exclusive opportunity for betting that they have a,
in the betting business.
yeah,
There is no better partner than
yeah,
Stanford Betting.
yeah,
So for us, it's
yeah.
you don't sleep with the enemy is my point. And so it's we're very loyal people, and we focus on what makes a difference as opposed to play one company against another. That
Yeah.
we're delighted to be working with Tempur-Pedic, and that's important to us.
Yeah, no, and I wasn't thinking otherwise. But I was wondering, like when my mom, I moved my mom to the couch, and she's sitting on the couch for a little while. She'll take a nap. And I have two
We could,
questions.
we could support the couch, no problem.
Yeah,
We can,
so
our system can be also under a mat at the entryway and measure as people come in and out of their room. It could be on the bathroom um, rug, whatever it is.
I got you. So, question for you. My follow-up question on that is the old system that I have now, which you first said was maybe like as much as 7 years old version, based on when you looked at my charts in the previous video. Um, what I do, I'll just give you my little ritual in the morning or in the night when I'm working with her. If I want to interact with her, I check to see if she's not in REM, and then I go approach her, and I can usually engage her and get her to go to the restroom in the middle of the night when I time it when she's lightly sleeping and maybe having a little arousal here or there, like small awakenings. But then in the morning, we try to schedule her time to wake up where we first start to get like the first moment where she's solid awake. And we have to go back and re-kick and edit the time on the old system every 5 minute increment. And then we get another read based on a chunk of 5 minutes. Does the new system, tease me, does the new system have real-time flow or near real-time flow, or is it still
Well,
a
we're,
five
we're
minute chunk?
You'd have to use the API. We have a real-time API,
Oh,
but
nice.
that's not in the consumer version or in what you can buy.
Oh, I
But with
see.
a real-time API, it's an API, it's a JSON style API. And so it's very explicit. It's got a lot of flexibility,
Okay.
but you're a software engineer, I assume. So
Yep.
you would know how to make those calls, et cetera, get
Sure.
those triggers and event alerts working. It's very standard ways, very similar to advanced database handling where you get triggers and event alerts for transactional systems and et cetera, right?
And then you're in a cloud, a particular favorite cloud that you're running in?
Um,
AWS or GCP?
we are a AWS partner, a certified software partner. So, but that's how our system runs. Um, However, we also run on other clouds, but our commercially deployed system, for example, the Tempur-Pedic system,
Yeah.
or what you're running, runs on AWS, and AWS is great for that. I mean,
Perfect.
we've been working with them for years, and that's been we have a great relationship. Amazon is very important. They also have an interest in what we do. They're interested in AI and the kind of stuff we do, especially given the fact that we're in the biosensing world. Everybody today in AI is trying to make agents and things, and which is all great, but we're not in that business. And there's like that fear of missing out, of
FOMO.
jumping
Yeah.
jumping into what they think is a gold rush, and that's what every day there's news that someone has a breakthrough, but that's not how it works. uh, Science doesn't work that way, and so we're in a place, I think, that where we have great synergism with Amazon. And Amazon has interest in 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 how people live and how people, of course, purchase things and et cetera. And I think that sleep is a third of people's lives. So that's of great interest. And so we have a good relationship with AWS, and
Yeah.
we're very happy with how we work together.
No, this is terrific. I don't really have any other major questions, but I want to kind of like summarize like the main impacts that we're seeing. Um, you know, um, I feel like the biggest change to my life has been with knowing that she's sleeping. I can check it in the middle of the night, and then it'll just continue recording, and then I'll just update it in the morning. So I can check and see, is she just really restless all the way till midnight? And then I might go in and give her another melatonin if she's not getting to sleep properly, or I might, take her to the bathroom. Maybe she's a little bit uncomfortable, but she can't report that she's uncomfortable because she's got Alzheimer's. So like being able to have that insight is is actually quieting to uncertainty, which is very distracting to me as a human, right? So as a caregivers, I think caregivers get exhausted being hyper vigilant. So if there's anything that I take away from like leveraging technology like yours in a really good way is it lowers my anxiety, it lowers my hypervigilance kind of drive. Probably my cortisol is lower. I'm probably a little bit healthier because I know for certain what's happening as it's happening, which is just
Well,
phenomenal.
it's been, but this in parallel, because you're now a better caretaker and you have more attentive, thanks to technology. And we're
Yeah.
not trying to replace you with technology, but we're trying to enhance you.
Right.
Your mom's quality of life improves.
Yeah.
So both your quality of life is improving.
It's a
And
win-win-win.
that is music to our ears. This is
Yeah.
what we work for, live for, and we're passionate about.
I'm so excited to have my and I told you that my brother did the sleeping concert music thing, which you probably know what that was. The musician, which my brother's gonna laugh that I don't remember, but he was over there in New York and he slept out. You know, the beds were all I guess it was Tempur-Pedic beds that were all out there, and the concert played for 8 hours. And they gave you this kit, which was your sleep tracker, and it sat in the box for many years until my mom had this down decline. And then my brother said, "Hey, you might want to try the sleep tracker." And I took it with me and we installed it, and I couldn't have been happier. And it's great. Now I have a new version, so I can't wait to see the enhanced, version of it. But thank you for chatting with me about it. I hit you up on LinkedIn and told you that we were going to mention you, and then we chatted a little bit, and then you were willing enough to come back on here as a follow-up to the last episode. So I really appreciate it because we give some continuity to the podcast flow here in these episodes. People want to know more about that. They're going to get it in this session. So,
Well, Jordan, what really attracted me is your video with your mom.
mm.
I think that even in this household, my household, everybody watched it. Everybody was say, "Wow, that is what caregiving is about." And so
Oh, that's something nice.
that was very impressive to us. And we said, that's what we live for.
Hey, I really appreciate that. That's heartwarming. It's been a grind, for the last several years, and I'm sure every caregiver would say it's been a grind. And they do say that, caregivers usually don't outlast the ones they're caring for. So just, leveraging technology to kind of offload some of the cognitive strain or some of the alertness or tracking, let the machine track that stuff. And I'm very big, anyone that has the phones, which now that your camera is inside those phones, people can't, go without them. We are cyborg, we're blended with our technology. I'm that sounds so weird with people that don't necessarily know what that means, but we're a blend of our technology and our brains. And as an occupational therapist, we use technology as assistive technology to enhance human performance. So I'm going to keep preaching using this tech that you have to help caregivers, live another day. So I think it's an alleviator of stress.
Well, thanks a lot. Thanks for having me and
Yeah.
giving us an opportunity to articulate all this. There's you're so interested in the space, which is fantastic for us because it's going to help a lot of people.
Well, thank you again for being here. And I do want to chat with you offline about going back to a large care company that I was pitching, and they didn't want to prototype something with me, but if your tool can work, they might be interested. So I want to follow up with you on that.
Okay, that would be great.
Yeah. Hey, thank you again, and we'll see you online. We'll see you on LinkedIn or wherever next. All right,
Okay,
take care. Thank you, Philippe. Cheers.
cheers.
Bye bye.